religion gets marginalized in the debates and so on. And that's all true. I don't think that's a reason for shutting up, but that's a reality that we have to deal with. But I think that Cahill is exactly right, that one has to look at more than one approach. What we say to commissions, how we lobby our legislators, I mean, those are critical, and religious communities ought to be involved there. But the formation of healthcare consumers seems to me to be entirely neglected. I mean, for example, one of the things that it's much like the environmental issue. One of the things that one would have to cultivate in order to cultivate a real ecological sensibility, real sensibility for ecological justice, is an ethic of sufficiency. What is sufficient? And we need the same thing in healthcare. What is sufficient and what do you need in healthcare? It is not clear to me that we're generating that kind of conversation in our religious communities. And that's a spiritual question. That's not an ethical, I mean, it's ultimately an ethical question. It's ultimately becomes a policy question. But that's a spiritual discipline. It's a conversation that has to we've got to somehow set our biological existence in this larger horizon. And once again, who's better to do that than religious communities? But on the issue of how do you affect to broader change, I think that Cahill is correct that as important as those strategies are, what the internet, I mean, the internet has a lot of negative, globalization has, and the internet is part of that. There's a lot of negative implications for the kind of gaps that we're talking about. But one very positive implication it has is that we cannot tell lies anymore as well as we used to be able to, right? I mean, if you say something about, how things are in East Timor, if you're connected to the right conversations around, you're gonna hear, firsthand what the real scoop is. And so the internet has a wonderful ability to expose what's not being said, expose the silences, to expose the lies, to expose the distortions with human experience. It has a wonderful potential for grassroots organizing, for bringing people together across barriers who would not have been able to do so before. And I think that there's great potential in the kinds of transnational advocacy networks that we're beginning to see. I was recently at a celebration for Margaret Farley, and one of the things that, who's an ethicist down at Yale Divinity School, and she's recently been involved in a big project called Sister to Sister, which is a grassroots organizing around AIDS, and specifically women and women's the disproportionate vulnerability of women to HIV infection and AIDS. Now, this all followed Margaret's frustration in going to the White House for World AIDS Day and listening to various leaders talk about what they would or would not do. And she and other people got involved in trying to organize religious women who have lots of influence and access to people on the ground on behalf of women. Now, it's a partnership between a very powerful institution, Yale University, and many people who have no power at all in the bigger world, but you bring it together. But they have information, and they have a story to tell, and you bring it together, and some things can happen. So I think that she's correct that one source of our hope today ought to be in the greater ability to facilitate these kinds of transnational partnerships. And I pointed to a couple of examples in the context of genetics that I think are promising.
I have two questions. You may have already addressed the second one. First of all, have you had any contact with the U.S. bishops on the issue of universal health care, and directly or indirectly? And secondly, would you give your assessment of their current posture on that issue?
I haven't had contact with the U.S. bishops. I have worked with Catholic Health, both on genetics and on the Catholic Health Association. You know, there are lots of reasons why the U.S. bishops are not knocking on my door, or the door of a great many women theologians, or for that matter, Catholic theologians. But what I would say, and that's not to say they're not listening to good people on this issue, but what I would say is this: it seems to me that in the recent presidential election, if we focus just on healthcare, the conversation got completely co-opted by an issue that was a non-issue. Social Security reform, if you listen to economists, it's a shell game. It's a total non-issue, but it captivated everyone's attention. The question of prescription drugs was an enormously important question, but it was treated, it seems to me, in the narrowest of ways. So we didn't really look at systemic reform. We looked at sort of how do you give more buying power to people, and that's an important question, but that's not the question I would want to ask about prescription drugs in this country. And it seems to me that the bishops, I mean, what do we associate with the bishop's voice? Well, abortion and stem cells, but in this most recent campaign, if we look back, what will historians say the bishop spoke most about? Distribution of communion to people who either voted for candidates or candidates. Well, I don't think we have to say a whole lot more about why their voice wasn't heard anywhere else. That's what we're going to remember. Does that mean that's not an important issue? I really would not want to dismiss the issue. I'm just saying that we've really put blinders on, and that has played very nicely, very, very nicely into the interests of the reigning political party. And so we're not really challenging, you know, all of President Bush's rhetoric now is of becoming a culture of ownership. We're a culture of life, and we're a culture of ownership. Now, nobody asks, how is the culture of life going to intersect with the culture of ownership? We're not asking that question. We're allowing them to live out there as though they can live in parallel universes. And in fact, they can.
You made a remark before, and I just wondered how you got to be so optimistic. You said it's no longer possible to lie. And yet, you just gave a marvelous example on the Social Security thing. I mean, endless lies come out of Washington, starting with WMD and so on and so forth.
Yeah, I should qualify that. I mean, it remains possible to spin and to construct and to present in our own way. I guess what I meant by it's not possible to lie is only that access to the media of all kinds generates a network of instant communication, such that, you know, I recall years ago, we would rely on the sisters in Nicaragua to tell us sort of what's really going on in Nicaragua. This is what we're reading, this is what the Times says, and people who are mission down there would write to us, you know, when they could, or call us, and you get a different story. And I guess what I'm saying is that we're now in a sort of feedback loop that is instantaneous, that is global, that is, I believe, not ultimately stoppable.